Hello and welcome to KCS Connects. My name is Jack Miller. I'm one of the co-directors of Key Clinical Skills. This is our way of helping to connect you with some of the literature that we believe to be relevant to your physiotherapy practice. This edition of KCS Connects is an article published in the Physical Therapy and Rehabilitation Journal. And we kind of dug back into the vaults a little bit for this one, but we really thought it was relevant, so we thought you'd like to see this. This is predictors of short-term outcome in people with clinical diagnosis of cervical radiculopathy. And the study was done primarily by Josh Cleveland and his team from Franklin Pierce College in New Hampshire, and it was published in 2007. Now, just set the background a little bit. Cervical radiculopathy is defined by the North American Spine Society as, first of all, pain in one or both upper extremities, and it's often in the setting of concurrent neck pain. It's secondary to compression or irritation of the cervical nerve roots, and it can be accompanied by motor deficits as well as sensory and reflex changes. Now, the overall annual incidence of cervical radiculopathy is 107 per 100,000 males, 64 per 100,000 females. Now, the prevalence is somewhat higher in females, and it's most prevalent in that 50 to 54-year-old age group. And if you look at the graphic over on your right-hand side, you can see very clearly, again, it's that younger population, particularly involving the C5 and C6 nerve roots, isn't it? Now, this particular study, it was a prospective cohort study, and they followed 96 consecutive patients with a clinical diagnosis of cervical radiculopathy, and they used the Wayner clinical prediction rule for that diagnosis. We'll look at that in just a few moments. You may ask, why didn't they use imaging? Well, if you look at the graphic on your right-hand side, you'll see why, and that is that MR findings can show a lot of different pathology in completely asymptomatic individuals, and so there's lots of false positives. So that Wayner clinical prediction rule has four different components: ipsilateral cervical rotation less than 60 degrees, positive Sperling's compression test, positive neck distraction test, and a positive median nerve upper limb tension test number 1. You can see that dependent on the number of variables, it has varying levels of specificity and positive likelihood ratios. But if you have all four of them positive, that carries with it a specificity of 0.99 and a positive likelihood ratio of 30. Now, the results of this particular study was that they found four different factors were to be predictive of a positive outcome for conservative management. A younger population, so under the age of 54. The dominant arm is not involved. Looking down, cervical flexion does not worsen their symptoms. And most importantly, a multimodal treatment program of at least 50% of the visits that included manual therapy, cervical traction, and deep neck flexor strengthening. Now, if we look at some other research out there, this is a paper recently published by Young, and it shows us here, this is an RCT of 43 different subjects, again, positive for that Wayner CPR, the neck disability index of greater than 10 out of 50. And the data was collected in the short term, 2 days or up to 3 days post-intervention. And what they found is they used thoracic manipulation in 22 of that population. And it was a standard supine manipulation to the upper thoracic spine. And they had to have an audible cavitation, a click, in order for it to be considered to be successful. Or they received a sham manipulation. You can see on the graphic on your right-hand side, the mean neck disability index, significant improvement, at least in the short term, for that group receiving manipulation to the upper thoracic spine. Another study done by Murphy looking at cervical manipulation, 31 subjects, and they again had the diagnosis of cervical radiculopathy as defined by both the Wayner cluster as well as corroborated with imaging. And again, they took a pragmatic approach. Within that population, 18 cases received cervical manipulation. And you can see that those individuals had significant improvement for their Bourne-Mouth Disability Questionnaire, as well as numeric rating of pain. So clinicians, we encourage you to utilize, first of all, an active approach in the management of your patients with cervical radiculopathy. And within that active approach, please consider the use of mechanical traction, deep neck flexor training, and manual therapy to the cervical and or upper thoracic spine regions. If you'd like to learn more about this particular paper, come visit us at www.keyclinskills.ca, where we have our research review library, and this paper is included within that. And if you'd like to learn more about the management of cervical radiculopathy, again, come visit us at www.keycleanskills.ca, where we have our online Managing Cervical Radiculopathy program. Thanks for your time.